This week on Physio Foundations, I'm talking to Professor Craig Hassad from the Faculty of Medicine at Monash University, and we're going to talk about how health professionals and health professional students can look after themselves, look after yourself during your career or during your studying. Welcome to the Physio Foundations podcast for another week, a podcast about the knowledge and skills that provide the foundation of expert clinical practice. So this week I'm talking to Professor Craig Hassad about your health, not your patient's health this time, about how you can look after your health and your well-being while you work as a health professional or while you study as a student. So just as a reminder, this is a discussion, as all these discussions are in this podcast, aimed at health professionals and health professional students. So always seek the guidance of a qualified health professional with any of the questions you may have about your own health or medical condition. So Craig's been working within the Faculty of Medicine at Monash University since 1989, and he teaches into a number of other faculties and departments, including the Department of Physiotherapy with myself and our colleagues. And he's also a coordinator of the Monash Mindfulness Program. So his teaching and research and clinical interests include mindfulness, mind-body medicine, lifestyle medicine, integrative medicine, and medical ethics. So Craig has developed medical curriculum that's been taught across the world. He's authored over 100 peer-reviewed papers. He's regularly invited to speak at conferences and courses around Australia and around the world. And he's also published a number of book chapters and over 13 or so books, and he's been featured in documentaries. And on top of all that, very well deserved, in 2019, Craig was awarded the Medal of the Order of Australia for his services to medicine. So I'm very lucky to have him here for a chat. So Craig, thank you very much for coming on Physio Foundations.
No, it's good to be with you, Luke, and hello to you. Long time no see.
It has been a long time. Just before we press record, we were talking about how the COVID lockdowns and the restrictions put on face-to-face contact. I mean, we haven't really caught up for a number of years, but I've known you since 2017. You've been presenting to our first-year physio students at Monash with the Health Enhancement Program, which is aimed at the health of the students rather than the students' patients that they'll be treating. So let's talk about that. But I thought, have I missed anything in my introduction? We go back. I'm sure there's plenty I have missed. Is there anything else that you want to add to your background? Perhaps we can tell the listeners a bit about your background and interests and current projects.
Fourth generation Richmond supporter. I'm not sure if that's the kind of thing you're meaning. Lover of good wine and philosophy. I'm not sure I could go on for a while, but I think that's probably enough.
Sure. And what about? So I mentioned the Health Enhancement Program, and that's how we know each other. So you teach that component of the Bachelor Physio course at Monash Uni. So what is the Health Enhancement Program, and when did it start, and what are the aims of the program?
Well, it's essentially a mindfulness-based healthy lifestyle program. And so I developed a program to teach medical students, firstly, about looking after themselves, because health professionals are often looking after patients, but we forget about ourselves, and the record of particularly mental health for medical students and doctors the story is not very good. And so, universities have to take this a little bit more seriously and see that the well-being of the student has to be an objective of their education. How you could study 5 or 6 years or, on physio for how many years of studying to be a health professional and graduate with worse mental and physical health than when you came into the course just doesn't make any sense to me. So I developed the program for the students, but also to lay a foundation so that what they learn and apply to themselves, they can understand a little bit more about how it might apply to their patients one day. So it's mindfulness is like the foundation, if you like, and then there are other lifestyle elements as well. It was first introduced into the medical curriculum in 2002, although there was a bit of mindfulness prior to that, but 2002, and then based on an acronym. And the acronym is ESSENCE, education, stress management, spirituality, exercise, nutrition, connectedness, and environment. So addressing each of those elements. The stress management includes the mindfulness and mind-body area, but each of the other elements are sort of built on that foundation of mindfulness.
it's so important to consider your own health and have a plan and a strategy for your career rather than just waiting for burnout and illness and mental health problems to occur. So how does the Health Enhancement Program specifically help physiotherapy students? Or I could broaden that to health professionals and health professional students in general. So you mentioned the components. How specifically can the program be helping students?
Well, just to take the mindfulness as the main foundation. Firstly, to manage your own mental health better, to learn to manage stress better. But mindfulness has all to do with attention, and our ability to focus. So to listen better, to communicate better, by having attention much more with the patient. Doing a procedure, for example, to be more attentive and present when doing that. To be aware of the decision-making process and aware of the various unconscious biases that often influence decision-making and diagnostic skills. So to improve clinical performance in that kind of way, to reduce errors. And also to have some strings to the bow one day when seeing patients who are dealing with physical stress or coping with chronic illness. They've got to have something more than just surgery and the script pad to go to. So what kinds of options can be recommended for patients that might be helpful for them? So to be informed about the therapeutic applications of these skills. And then to know, well, not only in what ways is physical exercise or a healthy diet important for your health to prevent or in the management of chronic illness, but also what are some of the strategies around behaviour change? I don't know if you're like me, Luke, and the rest of the human race, but behaviour change is not that easy. We often have this mismatch between what I know is good for me and what I do. So we might know something's good for us, but we're not doing it. Or we know something's not good for us, but we keep doing it anyway. And so there's this kind of gap in understanding our own motivation, our own behaviour, making more conscious choices, and how do we change those behaviours in a kind of a healthier way. And the only way as a health professional to really know how that health psychology works and making those healthy choices is that we actually learn from the inside out, not just from theory, but we apply these skills to ourselves. And as well, if we're not looking after ourselves as a health professional, our clinical performance drops, burnout, poor patient care, increased errors, etc. So our self-care, and this is an important message, I think, as a health professional, is not selfish. It's an investment of the well-being of the people we're trying to care for.
And sometimes it's only when things go wrong that you can really get some insight into that. But hopefully the purpose of having a proactive program in place is that students will learn skills to avoid them getting unwell in the first place. I really like what you said there about it's not what you know, but what you do, and that importance of behaviour change. And it's not just, and also the other point about improving clinical performance is not just fluff that's added to a program, or it's not just something you would do on the side. This is a part of your core clinical competencies to be able to look after yourself. And then if you can do that, you will develop insight and empathy into what it's like for other people trying to change their behaviour and looking after themselves.
That's right, because it's not easy. As soon as we try and change our own behaviour for the better, we find it's not that easy. But, as I was saying before about health, when speaking to the medical students, and you might have some similar kind of stats for physios as well, but like a doctor with depression, for example, makes about 6 times as many medication and prescribing errors as a non-depressed doctor doing the same job. And so this is a real call for us to see that self-care is an essential part of our responsibility to ourselves, but also it's an investment in the well-being of our patients, and so that we care for both at the same time. And we'd care better for our car a lot of the time than we'd care for our own minds and bodies, and that just doesn't make sense to me.
It doesn't. So stress over the last few years has been a very obvious problem affecting health professionals and health professional students, with all the different restrictions and the ongoing pandemic that we're all living under. So, and you've mentioned mindfulness and the importance of not only looking after your body, but looking after your mind. So can you tell us a little bit about mindfulness? What is mindfulness, and what's your interest in it, and how can people find out more and start mindfulness training?
Yeah, well, my interest in it arose really from my own student years, when I kind of, what I would now say, taught myself mindfulness kind of intuitively, to stay present, to learn to ride those waves of stress, lead up to exams, to stay in the moment, be on task, what you need to do. And so, and even things coping with, sporting injuries and so on. I kind of intuitively practice what I would now call mindfulness, but that, and things like meditative or mindfulness practices really helped to cope with, the stresses of being a student. So it I suppose etched itself deeply into my psyche that this is very useful, not just for myself, but for patients as well. And then thinking, well, this is the kind of thing that we should be taught about in medical school, especially when I became more aware of the burgeoning field of science and so on. So that I started teaching at Monash and finding a way to bring this into the training of our doctors. And then, of course, physiotherapy came on board, some years later, and saying we'd like something like that for our students. And we'd done quite a lot of research showing how much it had benefited our students, not just, feels good, but actually, objective measures of well-being and quality of life and mental health significantly improving as a result. So, developed these courses and then worked with physio, nursing and pharmacy and dietetics. And I think we now have close to 6,000 students each year at Monash who have mindfulness as a part of their core curriculum. So there's a lot of research out there, a lot of applications of this one generic skill, which we call mindfulness, that are very useful for health professionals. And look, I think it's something that, especially in this modern, distracted, kind of stressed world, is even more important than ever before, because we can't function well unless we manage our attention effectively. So develop programs because there wasn't other stuff going on in the world as far as having it as core curriculum. There are a few elective programs here and there, but as core curriculum, we're the first in the world to introduce it as core curriculum, and it's kind of grown from there.
The message seems to be that it's not just about health, but also about performance. And in knowledge occupations, and particularly in health professions, where really your mind is all you have, we're surrounded with distraction. We've got these weapons of mass distraction in our phone in our pocket the whole time. And I do feel for the students sometimes having all of that distraction around them, and they need to just on their own develop these skills of putting all of that aside and studying. So do you have any specific tips for students for their for managing distraction and developing perhaps a mindfulness habit or a habit in any other of the elements of the ESSENCE acronym that you mentioned before to help them through their study, help them be healthy and perform as well?
Yeah, I think if firstly thinking of developing positive capacities in terms of mindfulness, and being aware of the negatives, the things that can really degrade attention. In terms of developing the positive strategies, like we'd realize, look, if you want to build up your biceps and so on, you go to the gym, you do some reps, you build up your biceps, and it's going to take time, but over a while that muscle gets bigger and it can cope with more load, etc. Well, we've got to take our brain to the gym and do reps for the attention circuits in our brain. And there are very specific, we know a lot about the neuroscience of this these days, but there are very specific areas of the brain that have the important job of managing our attention, our ability to be on task in the moment, on point, So when you're sitting down practicing mindfulness meditation, it looks like a person sitting in a chair doing nothing. Like, get out of the chair and go and do something useful with yourself. What are you sitting in the chair doing nothing? But you're sitting there and your attention goes off. You practice noticing, bring your attention back. It goes off again, practice bringing it back. That's like doing reps for the attention circuits in your brain. when we go off, wander into worry, overthinking things, worry, etc., the brain's executive functioning areas switch off. All of a sudden we notice, you reorientate your attention, and then practice sustaining your attention until it goes off again. You do the same thing. Now, what that does is you take that out of the chair, whether you've been practicing for 5 or 10 or 15 or 20 minutes a day, however long, but you take it out of the chair and you practice being mindful in your day-to-day life. So you're a student trying to get some study done and you've got your notes in front of you and your mind just tiptoes off into a bit of a, oh, what if I fail? What if I've got to do a sup? Oh, what if I blow up in the Bosky station? What if this happens? And all of a sudden you're not getting any study done and you're wandering into a world of pain, creating stressors, thousands of them that haven't even happened. But if you're able to notice, oh, there I go again, attention back on task. Oh, yeah, but what if I fail? Back on task. So you're able to bring your attention back to the study. Or when you're with a patient and all of a sudden the patient's talking and you're looking at them and then you realise you're thinking about lunch, not listening to what the patient's saying. You bring your attention back and listen to what they're saying. So all of this is the informal practice of mindfulness, our ability to live and work mindfully for the other 23 hours and however many minutes in the day. And if we can do that, then it helps enormously. Now, one of the things I used to do when kind of made total sense to me when I was an intern, we used to have some very, very long shifts that are not legal these days, thank heavens for that, but very, very long shifts all day, all night, all day, all night, all day. And I realised that in the midst of a really complex series of clinical issues you're dealing with, one after another, that there are lots of downtimes, that you might have a 2-minute walk from one ward to another. And it's either 2 minutes of rumination while you walk on automatic pilot. Oh, why am I even doing this job? I can't stand it. I've chosen the wrong career. This is too much. It's either 2 minutes of rumination or it's 2 minutes of mental downtime, where now you just walk mindfully. There's nothing more complicated happening now than just walking down a corridor. And what I used to find, whether it was in the middle of a busy day or busy night, I would get to the other end of the walk, but I had a calmer, clearer, more attentive state of mind to take into the next complex thing. And then there was a 2-minute walk to the next ward, so 2 minutes of mental downtime. And then if ever got a meal break, we didn't very often, then it was just no more complicated than just tasting and enjoying the food. So living and working mindfully helped me not only to not get stressed and totally depleted, to sustain energy, but also to be more focused on the complex things we need to do in work. So that's the formal meditation practice, being mindful in your day-to-day life, and keep simple moments simple. Because we normally complicate simple moments with overthinking and worrying, etc. So they're 3 very practical things I think can be an absolute lifesaver, especially for new graduates and working in complex careers like in physio.
And the difference between ruminating and being mindful, being in the present moment, can be night and day, can be drastic. And it's just a change in that awareness of what your mind is doing. So does our society discourage doing nothing or being mindful? And does it encourage us to fill every second with thinking and lists and goals? And it's something that a journey you have to take yourself to get yourself calm and centered and mindful, because no one knows what's going on inside your head.
Yes. I think a lot of people who don't understand mindfulness see it as a waste of time, or see it just as a relaxation exercise to send yourself off to sleep, or so on, which totally misunderstands what mindfulness is about. I mean, it can help us to sleep late at night, but it's actually not about sleep. It's about being aware, quite the opposite. And so we don't kind of value it because we don't, if we don't understand it. But the other thing is that we kind of are drinking information these days, like we're drinking from a fire hose. And we're not managing the distractors very well. And so take something like technology and a phone. One of my favourite studies I cite to the students is when a student, for example, is performing tasks, their performance drops enormously if that phone is beside the laptop from which they're having their test done. So even if the phone is often face down, the fact that it's on the table drops performance significantly, because for the majority, the mind keeps going to the phone, which means it keeps on going off task. So the thing about managing the negative influences on attention, or things that degrade attention, are to manage our technology well, to turn off unnecessary notifications, take control of the technology rather than being bombarded by it. Do not complex multitask. Get good and efficient attention switching, but do not complex multitask. It's a recipe for disaster. And in industries where they have zero tolerance for, accidents like the airline industry, pilots are very good at efficient attention switching, but they do not do two complex things at exactly the same time. One of the other things that degrades attention is when we interrupt the flow of a complex task. You're doing quite a complex procedure or something complex, and you get interrupted. Not only do you notice when you come back to the thing you're doing before that it kind of takes you a minute or so to kind of, where was I up to, and to remember. So it's a wasted minute. But also that's when errors are often made, omissions are made. And so to reduce unnecessary interruptions, there was one study estimated about 8.5 hours of a working week is lost because the flow of complex tasks has been continually interrupted. So to minimise those things that degrade attention is a very important part of being able to be mindful.
Setting your environment up and thinking ahead to anticipating those negative effects on your attention, and those typically the phone, the emails, the lists of things to do. But if you're a parent, there's children and you're working at home, that's always almost impossible to string together a few hours of work. But there's things that you can't control, but things you can control as well. So I'm thinking of our students now. You're going to be lecturing to our Monash physio students in a few weeks' time, and they'll be back at the books doing their study. So, here's a perfect opportunity to take some of this. They've had its first semester, they've come on board, and they're ready to go for a second semester. Here's a perfect opportunity to put some of this into action. There's so much more we could talk about. We've sort of focused on mindfulness there. Where can people go to find out more about your work, Craig, and particularly with your work at Monash University with the mindfulness program?
Well, apart from, if it comes up in curriculum for students, then to use the opportunity. But there's also a Monash course we developed that's on the Future Learn platform called Mindfulness for Wellbeing and Peak Performance. So that's a 4-week online, totally free course. And it will walk you through about practices and reasons and how to apply this stuff in your day-to-day life. So that course, we've had close to 500,000 people do that course, and it's the highest ranked online mindfulness course globally. And it's free. So anybody can do that. So Future Learn, that's the platform that it's on. And if you've done that course, then the companion course, Maintaining a Mindful Life, would be good as a follow-up course, which looks more at the sort of communication, relationship, sort of the softer skills of mindfulness, I suppose you might say. People want to read a book. Of the books I've written, Mindfulness for Life with Exile Publishing is, I would say, the best all-round book that will give lots of good practical strategies and approaches. And then there's a lot of good apps around. So Smiling Mind and Headspace are the 2 highest ranked apps globally, and Headspace particularly good for mental health issues, although Smiling Mind is Australian and it's free. So that's a very good app to explore.
I've taken some notes there, and I'll add links to all those in the show notes for people who are interested. And as I said earlier, if people just Google you, they'll find a wealth of information on there as well. I know I'm mindful of your time, Craig. I'm really grateful for you coming on to, I guess this is an introduction to the important issues and some of the resources people can access. And hopefully we can speak again and take the conversation a step further. But thank you very much for the chat.
Thank you very much, Luke. It's been a pleasure.